Visual diagnosis of the skin. We talk about psoriasis, Western pathology, and diagnosis. Psoriasis is a chronic, non-infectious, inflammatory dermatosis characterized by well-demarcated erythematous plaques topped by silvery scales. The peak onset of psoriasis is in the second and third decades. It is unusual in children under 8. About 35% of patients show a family history of the disease. If one of a child's parents has psoriasis, there is a 25% probability that the child will be similarly affected. This probability increases to 60% if both parents have psoriasis. Psoriasis ranges in appearance from the typical chronic plaques involving the elbows to the acute generalized pustular form. There are many different types of psoriasis. The plaque type. This consists of well-defined disc-shaped plaques involving the elbows, knees, scalp, or hair margin. Gotthard type. This is an acute symmetrical eruption of drop-like lesions, usually on the trunk and limbs. This form usually affects adolescents or young adults and may follow a streptococcal throat infection. Flexural type. This affects the flexures of the axillae, the areas under the breasts and the groin. It is usually seen in the elderly. Localized type may be seen on the palms and soles, fingers and nails, and scalp. Generalized pustular type is a rare type of psoriasis characterized by pustules all over the body. Sheets of small, sterile, yellowish pustules develop on an erythematous background and may spread rapidly. The onset is often acute and the patient is unwell with fever and malaise. Type affecting the nails. Thimble pitting is the commonest change in this type of psoriasis, followed by separation of the distal edge of the nail from the nail bed. There is subungual hyperkeratosis with a buildup of keratin beneath the distal edge of the nail, mostly affecting the toenails. Another diagnostic sign of psoriasis is Auschwitz sign, which is seen when scraping of the superficial scales typically reveals tiny bleeding points. Because there are many types of psoriasis, other skin diseases may easily be wrongly diagnosed as psoriasis. The following table illustrates a differential diagnosis of the most common types of psoriasis. That is, for each type of psoriasis, the table lists other skin diseases that may look like that type. Although Chinese medicine treats skin diseases primarily according to the presenting pattern and not according to the type of skin disease, in the particular case of psoriasis, it is important to differentiate it from other diseases because of its prognosis. That is, psoriasis is usually more difficult to treat. So for plaque psoriasis, the differential would be psoriasis form, drug eruption. Palmoplantar psoriasis is differentiated from hyperkeratotic eczema or Reiter's disease. Scalp psoriasis, seborrheic dermatitis. Gotthard psoriasis is pityriasis rosea. Flexural psoriasis, candidiasis of the flexures. Nail psoriasis, fungal infection of the nails. Thank you for your attention.